Is blood from the urethra a sign of serious bladder problem? Imagine seeing blood when you urinate and wondering if it's something minor or something more serious. Blood from the urethra, called hematuria, can be a sign of various health issues, including serious bladder problems. But it's not always a cause for alarm. To understand this better, let's look at how the bladder and urethra work. The bladder stores urine, which is made in the kidneys and travels down the ureters. When you urinate, urine passes through the urethra and out of the body. The urethra's function is to carry urine from the bladder to outside the body, and it also plays a role in sexual function. Blood in the urine can come from anywhere along this pathway. If you see blood in your urine, it's called gross hematuria. Sometimes the blood is visible to the naked eye, and other times it can only be detected through a urine test, which finds microscopic blood. When blood appears in the urine, especially if it's bright red or pink, it can be an early sign of bladder cancer. Bladder tumors can cause blood vessels to break, leading to bleeding into the urine. This is why blood in the urine is often one of the first symptoms of bladder cancer. However, not all blood from the urethra indicates cancer. Many other conditions can cause hematuria. Urinary tract infections are common culprits, especially if you have pain or burning during urination. Kidney or bladder stones can also cause bleeding if they irritate or damage the lining of the urinary tract. Benign tumors, prostate enlargement in men, or physical injuries from trauma can also lead to blood in the urine. Sometimes, certain foods, medications, or even vigorous exercise can temporarily discolor urine, mimicking blood. Because blood from the urethra can signal a range of issues from mild to severe, it's important to see a healthcare professional if you notice blood when you urinate. The doctor will perform a physical exam and may order urine tests to check for blood and infection. Imaging tests like ultrasound or CT scans can help identify stones or tumors. A cystoscopy, where a small camera is inserted into the urethra to look inside the bladder, is often used to find or rule out bladder cancer or other abnormalities. Early diagnosis is key, especially for bladder cancer, because catching it early can lead to more effective treatment and better outcomes. Remember, having blood in your urine doesn't automatically mean you have a serious problem, but it does mean you should seek medical advice promptly. Maintaining bladder health involves paying attention to symptoms like hematuria and getting checked out without delay. Always consult a healthcare professional for personalized diagnosis and treatment options.